Manual muscle testing is a method used to obtain information about the function of an individual muscle or muscle group while performing a specific movement against gravity or manual resistance. It is used to identify muscle weakness and to assess neuromuscular, musculoskeletal, and neurological disorders. Manual muscle testing commonly utilizes the so-called Oxford scale, or a modified version of it. The Oxford scale, also known as the MRC scale, was standardized already in the early 1940s in the publication Aids to the Investigation of Peripheral Nerve Injuries. Manual muscle testing is used to assess problems related to contractile tissue. Contractile tissue refers to muscles, tendons, tendon insertions, and the nerves innervating the muscles. Pain assessment is an integral part of the testing procedure. Reduced muscle strength combined with pain suggests different clinical conditions than reduced muscle strength without pain. Patterns associated with contractile tissue and nervous tissue lesions are: no pain movement is strong. Pain movement is relatively strong. Pain movement is weak. No pain movement is weak 1. Strong and pain-free movement indicates that there is no lesion of the contractile unit being tested or of the nervous tissue supplying it. There may still be muscle tenderness or pain on palpation, but the muscle and its nerve supply are unlikely to be the source of the patient's symptoms. 2. Movement that is strong and painful indicates a local lesion of the muscle or tendon, which could be, for example, muscle strain. The severity of the muscle strain determines how intense the pain is and how much muscle strength is reduced. Also, for example, in cases of tendinosis, tendinitis, and tenosynovitis, strength may remain strong, but pain is felt in the tendon area. However, the strength is often not as great as on the healthy side. If there is a partial avulsion fracture, again, the movement will be strong and painful. Typically, there is no primary limitation of passive movement when contractile tissue is injured, although end range may be painful. 3. Weak and painful movement typically indicates a severe lesion around the joint, such as a fracture. The resulting weakness is usually caused by reflex inhibition of the muscles surrounding the joint secondary to pain. 4. Weak and pain-free movement indicates a severe rupture of a muscle or its tendon, or involvement of the peripheral nerve or nerve root supplying that muscle. When neurological involvement is suspected, the examiner should be able to distinguish between muscle weakness resulting from nerve root involvement and weakness resulting from a peripheral nerve lesion. The examiner should also be able to differentiate between upper motor neuron and lower motor neuron lesions. In cases of a complete muscle or tendon rupture, pain may still be associated with the tested movement if surrounding muscles that assist the movement are also injured or become overloaded during the test. In the Oxford scale, a score of 0 indicates that no visible muscle activation can be detected, whereas a score of 5 indicates that the subject is able to perform the movement against strong resistance throughout the full range of motion. A score of 3 indicates that the subject is able to perform the movement against gravity, but not against any additional resistance. Scales such as the Oxford scale serve as crude measures of muscle strength, but because the method is entirely subjective, certain challenges are associated with its use. The most commonly used form of manual muscle strength testing is isometric testing, and the Oxford scale can also be used for this type of assessment. In this method, the examiner instructs the subject to hold the body part stationary while the examiner attempts to move it. However, the assessment is first performed against gravity, since a grade of 3 is assigned when the subject can complete the desired movement against gravity through the full range of motion. Isometric strength testing begins by positioning the joint in its resting position. The examiner then grasps the body part and instructs the subject to hold it still by saying, "Don't let me move you." The examiner gradually applies force in an attempt to move the body part while the subject resists the movement using muscular force. To ensure accurate and reliable muscle strength testing, proper technique is essential. The examiner should position the body part correctly and stabilize the joint to improve test specificity and prevent compensation by other muscles. Tight or restrictive clothing should be removed to allow unrestricted movement and to enable the examiner to palpate and observe the muscles being tested and assess the quality of muscle contraction. If the subject cannot perform the movement against gravity, the muscles should be tested in a gravity-eliminated position by positioning the patient so that the movement occurs parallel to the ground and the effect of gravity is minimized. If the patient still cannot produce the movement, the examiner should palpate the muscle and ask the patient to contract again, assessing whether any muscle contraction can be felt. One limitation of isometric muscle strength testing is that it is typically performed with the joint in its resting position, where the muscle length is often optimal for force production. As a result, muscle weakness that may be present at other muscle lengths can go undetected. Conversely, in some cases the muscle may be shortened or lengthened even in the resting position, resulting in reduced force production specifically at that position. To obtain a more comprehensive understanding of muscle function, isometric strength assessment should be performed with the joint positioned at different angles. This eccentric testing method is referred to as the break test because the examiner attempts to break the position by gradually increasing force until the body part maintained by the subject begins to move. The subject then controls the movement eccentrically. The instruction given to the patient is the same as in isometric testing. Don't let me move you. The break test can be performed throughout the joint's full range of motion, although in some situations a smaller range of motion may be more appropriate. The Oxford scale is not an interval scale. A score of 3 does not correspond to 50% of normal muscle strength. It is also often difficult to distinguish between grades 4 and 5. When repeating measurements, it may be challenging to produce the same amount of resistance each time. An advantage of manual muscle testing is that it is quick to perform and does not require special equipment. Reliability in manual muscle testing appears to improve with examiner expertise. Experienced examiners have been shown to achieve better reliability than novice examiners. Inter-rater reliability in manual muscle testing appears to be good, whereas inter-rater reliability varies. Similarly, reliability differs depending on which muscles or muscle groups are being tested. As an alternative to manual testing, muscle strength may be assessed using functional tests, such as single leg or double leg squats, stair climbing, or heel raises. These tests provide useful information about the subject's ability to function in everyday life, while also offering insight into movement control and the integration of different bodily functions during movement. Manual muscle testing does not provide precise quantitative information about muscle strength. During muscle strength testing, patients may inadvertently compensate for weak muscles by activating adjacent or stronger muscle groups, a phenomenon known as substitution. Substitution may create the false impression of normal muscle strength. To prevent substitution, the examiner must stabilize adjacent joints, position the limb appropriately, and carefully observe or palpate the target muscle to confirm its isolated activation during testing. Patients with severe cognitive impairment, profound movement disorders, or fluctuating motor symptoms may struggle to perform or sustain the required testing maneuvers, leading to unreliable results. If accurate numerical values are required, a measurement-based method should be selected. A handheld dynamometer is a simple clinical tool for measuring muscle strength. The most reliable method for measuring muscle strength is an isokinetic dynamometer.
Thank you for your attention. This video was produced as part of the Move On project and is co-funded by the EU.